Good morning. We're still at it. We've gotten some donations and we're so close to the $5,000 milestone. And I appreciate my new donators who are giving to the campaign for prostate cancer awareness and fundraising. I also appreciate those who have been sharing my link and a few of those who have been sharing your story. Today is a topic. What are some of the first things you need to do if you get a prostate cancer diagnosis? This kind of applies to anybody who's getting any kind of cancer diagnosis. First thing is, however you feel and choose to feel, it's okay. Take a breath. Your feelings are valid. If you're scared, if you're angry, if you're sad, you don't know what to do, those are all valid things. But here are some things that I've learned through my experience about what I would encourage you to do. Reach out to your family and tell your family. It's important. They should know. But more importantly, you need them to know for your benefit. They can become a support network for you that you probably didn't know you had. I know some people have families where perhaps there's some estrangement going on, but if anything was ever wrong, we all can get together for a funeral. We can all get together, surround folks for prostate cancer and survive, because it's a survivable disease if you're screened regularly and early. I'm going to keep preaching that message. Get screened. If you're a black male, you need to start getting screened in your 40s, especially if you have a family history, or at the very least start talking to your doctor. If you're any other individual who has a family history, I would say in your 40s as well. The old adage of probably being screened at 50 may work for some folks. It does not apply to everyone, and we need to stop that misinformation that's going out there. And doctors, I think you all need to do better about being consistent about the message you're putting out there. It's unclear, but I'll give everybody my experience. If you're a black male and you're in your 40s, you need to be screened for prostate cancer. Those of us who have a family history, we have a 1 in 4 chance of being affected. Those of us who don't have a family history, it's a 1 in 5 chance. Those who don't have any history and you're not a black male, maybe a 1 in 8 chance. But nonetheless, here's the first things I want you to do. Tell your family. You need your support network. Second thing is, reach out to a support group. There's a lot of information that you can learn from a support group. These individuals have gone through this. They all have different experiences. They all have different doctors, and every doctor doesn't tell all of their patients the same things. So you can learn a lot from talking to people in a support group. So that's the second thing I want you to do. The third thing I want you to do is gather your records. Get the information for your diagnosis, perhaps your biopsy results. Get that information. It may be in MyChart. It may be in Epic. Print your own records out. Take that information to another doctor's appointment. I would strongly encourage you to go do what they call getting a second opinion and a third opinion. When I got my diagnosis, I talked to 5 doctors. I reached out to friends. I was open about it. I told them, and I was happy that I was open about it, and I told them about it. Some of them were actually physicians, and they gave me advice. Don't do this. You want to make sure you do that, etc. Everyone's specific situation is different and unique. But talk to your family. Get your records together. Ask questions, talk to your doctors, get second, third, fourth opinions. Then you need to make a collective, informed decision about which treatment plan is going to be right for you. Everyone's treatment plan could be different. After that, follow through with your treatment plan. Follow through. Some parts are going to get hard. Sometimes it may get expensive. If you're having trouble funding it, reach out to Zero Cancer. Reach out to other organizations and see if they can provide some healthcare navigation tips for you to find the resources that you need. But I don't want you to do it alone. You're going to find a lot of individuals who are out there who have gone through this before. You don't need to go through it like it's the first time it's ever been done. So my tips for today is, if you ever get diagnosed with prostate cancer, understand if you caught it early, it's a very slow forming cancer with a lot of treatment options, and I would imagine in the future we'll even have more options in our toolbox to help us fight this disease that's still the #1 cancer affecting men in this country. So thank you again for everyone who's been donating. We're not done yet. We're very close to the $5,000 mark. I need help getting over that milestone and eventually pushing forward to 50%. I'm still out here. I'm doing my training. I hit this mountain in about 30 some days, but I need to get my fundraising goal done before the end of August. That's my goal. So help me achieve it. I look forward to seeing y'all again on the next video. Thanks.